Understanding total prostate-specific antigen PSA, a key tool for prostate cancer screening. The prostate cancer is one of the most common types of cancer in men worldwide. The challenge with prostate cancer is that it often grows slowly and can go undetected for years, with no symptoms until an advanced stage. Early detection is therefore critical for effective management and treatment. The prostate-specific antigen PSA test is one of the primary tools for early detection of prostate cancer. The PSA test measures the level of PSA in a man's blood, a protein produced by normal and malignant cells in the prostate. The results of this test can provide important insights into the health of the prostate and help determine if further testing or intervention is needed. However, understanding the impact of PSA levels requires a nuanced approach. Not all elevated PSA levels indicate cancer, and not all prostate cancers produce high PSA levels. This complexity requires a thorough understanding of what PSA levels mean, how they are measured, and how they are interpreted in the context of other clinical findings. What is considered healthy? The concept of a normal PSA level is not as simple as it may initially appear. While many healthcare providers use general reference ranges, the interpretation of PSA levels must be individualized, taking into account factors such as age, race, family history, and overall health. Traditionally, PSA levels below 4.0 nanograms per milliliter are considered the upper limit of normal. Men with PSA levels below this threshold are generally considered to be at low risk for prostate cancer, while men with PSA levels above 4.0 nanograms per milliliter are generally recommended for further evaluation. However, this threshold is not absolute. Age is an important factor that affects PSA levels. As men age, it is normal to have gradually increasing PSA levels, even in the absence of prostate cancer. To address this, some healthcare providers use age-specific reference ranges when interpreting PSA results. Men in their 40s, if the PSA level is less than 2.5 nanograms per milliliter, it is generally considered normal. Men in their 50s, the upper limit of normal may increase to around 3.5 nanograms per milliliter. Men in their 60s, PSA levels as high as 4.5 nanograms per milliliter may be considered normal. Men 70 years and older, levels up to 6.5 nanograms per milliliter may still be within the normal range. Using age-specific PSA ranges can help reduce unnecessary biopsies and reduce anxiety in older men who may be born with higher PSA levels. In addition to age, there are several other factors that can affect PSA levels. Benign prostatic hyperplasia, commonly called BPH, is a non-cancerous enlargement of the prostate gland. BPH is common in older men, and the enlarged prostate gland can cause PSA levels to rise. While BPH itself is harmless, it can cause symptoms such as difficulty urinating, frequent urination, or a weak urine stream. Because BPH can raise PSA levels, it is important to differentiate between BPH and prostate cancer. This often requires additional testing, such as a digital rectal exam, DRE, or imaging studies. In some cases, a prostate biopsy may be needed to rule out cancer. Prostatitis, or inflammation of the prostate gland, is another common cause of elevated PSA levels. Prostatitis can be caused by a bacterial infection or other factors that cause inflammation. The condition can be acute or chronic, and is often accompanied by symptoms such as pelvic pain, difficulty urinating, or flu-like symptoms. Acute prostatitis often causes a significant and rapid increase in PSA levels. Chronic prostatitis may cause a mild increase in PSA levels. Because the symptoms of prostatitis can be similar to those of more serious conditions, such as prostate cancer, it is important to differentiate between them through careful evaluation and testing. PSA is a protein produced by the prostate, and its levels may temporarily increase after ejaculation. This is because ejaculation causes the prostate to release more PSA into the blood. For this reason, men are often advised not to engage in sexual activity 24 to 48 hours before taking a PSA test to prevent an artificially elevated result. While this increase is not usually a cause for concern, it highlights the importance of being well prepared before a PSA test to ensure an accurate reading. A high PSA level does not necessarily mean you have cancer. It may be caused by one or more of these other factors. Studies have shown that men with PSA levels below 4.0 nanograms per milliliter may have prostate cancer, while some men with higher PSA levels may not have cancer. These are my personal opinions and are for reference only. Thank you very much for watching and listening.